Hi everyone. Well, anyone who's bumped into me over the past week or so knows that I'm feeling really positive at the moment. I'm delighted to see the number of COVID patients in our hospitals reducing dramatically, and so pleased and proud of the way that our trusts have dealt with the COVID-19 pandemic. You've all done the most amazing job, and I'm really proud of the quality of care that's been provided to our patients. We've admitted 385 patients with COVID since the outbreak started across both our trusts, and we've achieved really good outcomes. Nearly 286 of these patients have subsequently been discharged. On a personal basis, I'm also really pleased to see the lockdown being cautiously lifted. Now, I know that we'll all have different views on this depending on our perspective, but for me, I'm really pleased to see the restrictions being lifted so long as we continue to respect this virus. It hasn't gone away, and as people move around and interact more freely, the risks will be higher. But this means that we've got to take more care when we're social distancing, continuing to prioritise the hand washing that we do and everything that we tell our friends and family about avoiding the spread of infection. We really are in this together. Thinking about our own services, it's clear that COVID-19 will have a long-term impact on our people and on our practice going forward. And there are lots of challenges we're thinking about at the moment as we're planning to bring back more planned care, preparing for further spikes, looking after our staff and making sure we provide safe care. Lots of things to be managed. For example, how many staff are going to be actually available, recognising we need to protect those at greatest risk of COVID-19. How many beds are we going to have available? How many do we need to keep ready for a further spike? How many do we need to keep closed to allow more space on our wards? How much longer does it take to do things in light of all the PPE we wear and the testing that has to go on? And of course, for the public, we have to say, how are they going to feel coming into the trust? So both trusts have been actively encouraging patients to come in and access the care they need. And this has included participating in the Pan Dorset Here For You campaign. Our very own Dr Gary Cumberbatch, Clinical Director for Emergency Care at Poole, and Dr Cami Tavanason, one of the stroke consultants at Bournemouth, have been speaking up, reminding the public that we are here and we're open for business. Thanks Cami and Gary, these are really important messages and they appear to be landing well. Emergency attendances and admissions have risen significantly over the past 2 months, and we're starting to do lots more planned care. However, the sober truth is that we're nowhere near our normal levels of activity, and it'll be some time before we're fully recovered. We know we're going to have less beds available going forwards, given the need to create more space in our bays. Whilst this is a concern, we're hopeful that we may be able to manage with less beds, given the new pool model of community care that's been introduced during COVID. This has really helped the flow of patients through our hospital and reduced length of stay. The community response over the past few months has been phenomenal and has made a massive difference in our ability to cope with high numbers of COVID admissions. It's critical that this community offer is continued going forwards if we're to manage with less beds. And we're so pleased that all our Dorset partners have committed to maintaining this new Home First programme. In this way, there'll be a consistent offer for local people that will allow swift discharge, with all the longer-term assessments and planning taking place outside hospital in people's own homes. And it's at this stage that I really want to pay tribute to our fantastic integrated discharge teams working within both our trusts. These teams bridge that gap between the hospital, the community, social care, and in doing so, they get patients out of hospital swiftly and safely. This is so important because we know that patients who stay in hospital longer than necessary are at risk of infection, of falling, so it's so important that we can discharge swiftly and safely. We are hugely proud of our Department of Medicine for the Elderly at Poole and the Older People's Services at Bournemouth, and every day they're doing such a great job for patients. Last week we celebrated the 10th anniversary of the RACE unit in Poole. This was introduced in June 2010. And since then has halved the length of stay for older patients and safely discharged half of patients within 48 hours. Over the past year, we've been bringing together our older people's teams as one of the first pilot specialties in advance of the merger, and it's fantastic to see the progress that's been made. So in closing, I just want to remind you that it's the 72nd birthday of the NHS this Sunday. It's a great opportunity to reflect on the past few months and to thank all our NHS staff in the hospitals, in the community and in primary care, all those in the care sector who've been working to support patients and clients. We need also to thank our public who've done such a great job of complying with the new guidance and staying at home and helping to keep people safe. So this Sunday, make sure you get out there at 5 p.m. Let's have our largest clap ever and say a really big thank you together. So, in the meantime, take care, continue to respect this virus and do look after each other.